Assalamualaikum warahmatullahi wabarakatuh. Welcome to our video. We are from Bachelor of Nursing 6B Level B. Group 3 is Nita Hikmatul Aini, Novif Purwati, and Rizky Handayani. Happy watching!
Case 3. The patient Mr. Green, 57-year-old, gentleman with aggressive prostate cancer who is took care of by the nursing team in the oncology department of a general hospital in Brisbane, Australia. Mr. Green was diagnosed with prostate cancer 7 years ago, but refused medical and surgical treatment at the time. The cost to seek alternative treatment and did not follow up with the urologist over that 7-year period. Mr. Green has now presented with anemia and hypoproteinemia. After several diagnostic tests over a period, it was discovered that the cancer and metastasis to his bones. It had spread locally to his lymph nodes and the primary tumor was invading the bladder and partially obstructing the left kidney. Mr. Green had several admissions over a 2-month period for various reasons. On the last admission, Mr. Green was told that they might only have 4 to 6 weeks, or previously it was 6 to 12 months, to live after a cystoscopy, so future extensive growth of the tumor. It was determined that any future surgical or medical intervention would not be appropriate in this case, and that a palliative care regimen was the next step. At this point, the patient reported to the healthcare team that he had resigned himself to the fact that he was going to die. Mr. Green pulled on of the author's colleagues aside and confided to the nurse that he planned to kill himself, and that it was a secret that the nurse was not to tell anyone.
1. Identify and clarify the ethical pro. A. Ethical principles. Autonomy is verificated. B. Ethical issue. Freedom is control. C. Problem statements. 1. Does the patient have the right to make choices for himself that might result in harm, or can the nurse take control and do what benefits both his and the patient? Data gathering. Relevant fact. 1. On the last admission, Mr. Green was told that he might only have 4 to 6 weeks. Previously, it was 6 to 12 months, to live after a cystoscopy showed further extensive growth of the tumor. 2. Mr. Green was diagnosed with prostate cancer 7 years ago, but refused medical and surgical treatment at the time. He caused to seek alternative treatment and did not follow up with the urologist over that 7 year period. 3. At this point, the patient reported to the health care team that he had resigned himself to the fact that he was going to die. Next, B. Stakeholders and the concerns. Stakeholders, patient, Mr. Green is desperate with the disease. The concern, nurse in check. The nurse in charge of providing nursing service to Mr. Green in the oncology department of the public hospital in Brisbane. 3. Identify options. 1. Nurse will disregard hospital standard procedure by letting patient out of the hospital. Advantage: the patient feels free to do what he wants before being single. Disadvantage: the patient's condition will get worse.
2. Nurse will obey facility rules by not allowing patient to leave the hospital. Advantage: patient can get good care and good palliative care. Disadvantage: patient will feel terrible pain. The patient will feel that his request is neglected. 3. Nurse will change the mindset of patient in dealing with the pain experience, for example, by positive thinking. Advantage: patient will come back excited to life and think of good things the worshipping before trying. Disadvantage: patient will still feel depressed and hopeless with what is experienced. 4. Decision and justification. A. Recommended decision. Nurse must choose option 3. B. Justification. The nurse must consider all nurse opinion but still put the patient first. Nurse must obey the rules of the facility by not letting sick patient out of the hospital and always advising patient to think positively, encouraging patient to worship according to his belief.
Okay guys, thank you for watching. Wassalamualaikum warahmatullahi wabarakatuh.